Hello everyone, welcome to your lecture on critical thinking and clinical judgment. This lecture will cover the key concepts from your chapter. Please go ahead and review the assigned readings listed in your Canvas module, and you can also use your guided note sheet that I uploaded in Canvas to take notes as we go through these slides. These are the learning objectives that we will be covering in this lecture. These are some important key terms that you will see throughout the slides. So let's think for a minute. Think about a problem that you were confronted with in the past. How did you come up with a decision to fix it? What resources did you use? Past experience? Knowledge about the problem? The time you had to fix it? The desire to be right, and intuition. All of these play a role in how we fix problems in life on a daily basis. Some important terms that you should remember are problem solving, basically obtaining information to clarify the problem, suggest solutions, try the solution, and evaluate the effectiveness of it. Then our inner sense, which is also known as intuition. And then decision making, where you actually choose a course of action, how you will fix the problem. Now, scientifically, problem solving has certain steps, and it's called the scientific method. And that's identifying the problem, collecting the data, formulating a hypothesis about what you think the problem is, testing the hypotheses, and then evaluating the results of the test to see if it actually worked. So this is the general scientific method. How do we solve problems in nursing? I don't know. Well, we can't do that, right? So let's look at how we solve problems in nursing. Sorry, I couldn't resist it. I just love Lucy's memes. Okay, so in nursing, to solve problems, we use critical thinking to make clinical judgments to arrive at clinical decisions. Basically, you're using your mind and your critical thinking abilities to make judgments about a situation, and then you use those judgments to make a decision, choose a course of action. So the critical thinking is the ability to think in a systematic and logical manner with openness to question and reflect on the reasoning process. For example, the questions you would ask are, why does the patient have this condition? What caused it? How does the condition normally affect a patient physically or psychologically? Are the symptoms shown by the patient what I would expect for the condition or situation? Are these signs and symptoms associated with worsening of the condition? What do I really know about this patient? And what care options do I have? So these questions will guide your decision making in nursing, in everyday situations when you're confronted with them. Let's take a look at an example. Mr. Payne is a 68-year-old who had abdominal surgery for a colon resection and removal of a tumor yesterday. His nurse, Anna, finds the patient lying supine in bed with his arms held tightly over his abdomen. His facial expression is tense. Anna checks the patient's surgical wound, and she observes the condition of the dressing. She notes that he winces when she gently places her hands to palpate around the surgical incision. She asks Mr. Payne when he last turned onto his side, and he responds, "Not since last night." Anna also says, "Show me where you're having the pain." The patient points to his incision and says, "It hurts too much to move." Anna assesses Mr. Payne with a pain rating scale, for which he rates his pain at a 7 out of 10. Anna refers to the electronic health record, noting that the patient last received a pain medication 5 hours ago. What should Anna do? Anna has to use critical thinking to make a clinical judgment to arrive at a clinical decision. So let's help her with this process. So what does she assess? What are the cues that she recognizes? She would consider the information she observed and gathered and determine the priority problem based on the cues she gathered, right? This is where you collect your subjective data and your objective data. So patient is lying supine in bed with his arms held tightly over his abdomen. Facial expression is tense. He winces when she gently touches him by the surgical site. He rates his pain at a 7 out of 10. When asked when he last turned onto his side, he responds, not since last night. So now you have lack of mobility. So the two issues that she assesses are pain and lack of mobility. Those are her hypotheses, right? Now she has to plan and prioritize. Think critically to make decisions about the priority problems. So what is the most important thing she needs to take care of first? The pain, is to reduce the pain. And then she needs to encourage him to be mobile, because mobility is a very important thing, especially after surgery, right? Then she's going to take action. She's going to administer the pain medication. Then she's going to obtain assistance from the CNA to position the patient more comfortably, just to get him to move a little bit. Now, critical thinking has different levels. Anna used her critical thinking, and it could be at a basic level, a complex level, or a commitment level. Basic is just basic, where you feel one single solution will resolve everything, right? It's an early step in developing critical thinking, and that's how new nurses feel when they first start practicing on the floor. Then we have complex thinking. This is independent decision making. You generate ideas quickly. You do it on your own. Your thinking abilities and your initiative to look beyond the expert opinion begin to change. You learn that alternatives and perhaps conflicting solutions exist. You basically learn that there are other solutions as well, right? Different than what you usually do. And in this stage, you learn to take a variety of different approaches to solve the same problem. Now, the commitment level is the highest level. This is where you gather more information. You consider a wide array of clinical alternatives for that same problem, right? You recognize that sometimes a proper action is not to act or delay an action, right? For example, if the pain medication is causing the patient respiratory depression, then you might decide, okay, I'm going to hold this medication. I'm going to contact the doctor. Yes, it's due right now, but I will hold it because I don't want the patient to get worse. I will notify the doctor, and maybe the doctor will, order something different for the patient. The able to apply all elements of clinical judgment model almost automatically. It becomes a muscle memory. So this is the stage of commitment. Now, when Anna enters, let's continue with the case study. When Anna enters into Mr. Payne's room and finds him to be restless and short of breath, and he tells her, I have this terrible pain in my chest, she thinks critically. She wonders if something other than the abdominal incision is causing Mr. Payne's discomfort. She asks Mr. Payne, is the pain you're feeling now different from before I gave you your medication? Anna already gave him the pain medication for the stomach, but now he's saying he has chest pain. The patient tells her that the pain feels sharper in his chest. Anna quickly takes a set of vital signs. His heart rate was 88 and is regular 1 hour ago and is now 102 and irregular. So that's a change, right? Then Anna calls the physician and notifies her of the changes in Mr. Payne's condition. Anna thought outside the box. Rather than assuming that Mr. Payne's continued pain was from his incision, she actually gathered more data and recognized that it may be he's experiencing something different and something worsening of a condition, like a life-threatening condition, or a pulmonary embolism. Maybe he has a blood clot in his lungs. So, components of critical thinking. What are those? You have critical thinking competence. You have specific knowledge base. You need to know knowledge about the situation. First, you have to have the critical thinking ability, then have knowledge about the situation, have experience in this area, then the environmental, like the time pressure, setting, task complexity, interruptions that you get while you're taking care of your patients. That can affect your critical thinking. Attitudes for critical thinking. What are your attitudes? Then we have standards for critical thinking. For example, intellectual standards, professional standards, standards of practice, ethical standards, criteria for evaluation, and professional responsibilities. So all of these are components of critical thinking for nurses. So now let's look at the situation. Let's go ahead and, as you're reading this, figure out, okay, what are the important cues over here? So underline, highlight components of critical thinking that Anna possesses. What critical thinking components does Anna have? Anna previously earned a bachelor's degree in education and taught high school for a year. She is now in her second year as an RN. She is taking additional classes to further her education, including courses in health ethics and population health. So all of that is the knowledge base that Anna has, and she's increased it, right? She's got her BSN, and now she's doing additional courses. Her experience as a staff nurse has allowed her to develop knowledge about a variety of surgical procedures, the effects of different medications, physical and psychological responses patients typically show to their treatment. So now this is where Anna built her experience. When Anna was finishing her last year in nursing school, she worked as an assistive personnel in a nursing home. She spends considerable time interacting with older adult patients, giving basic nursing care. Each patient provided her with valuable learning experiences, which she applied in her work with her patients as a nurse. Specifically, she developed good interviewing skills, gained understanding of the importance of family in an individual's health, and learned to become a patient advocate. She also learned that older adults need more time to perform activities such as eating and bathing. Therefore, she has adapted these skill techniques. So basically, Anna's knowledge, her experience, and her desire to be right. All of these are components of critical thinking. The attitude. Critical thinking attitude, confidence, thinking independently, being fair, listening to both sides of the discussion, responsibility and authority. Ask for help if you're uncertain about how to perform a nursing skill. Refer to a policy or procedure manual to review the steps of a skill. Report any problems immediately. Follow standards of practice in your care. Right? Risk-taking. What is risk-taking? We're not talking about reckless risk-taking. Risk-taking refers to if your knowledge causes you to question a healthcare provider's order, do so. Be willing to recommend alternative approaches to nursing care when colleagues are having little success with patients, especially if your ideas are supported by scientific evidence. Just questioning the healthcare provider's order if you feel it's incorrect, if you feel there's an error there. Right? Then we have discipline, being thorough in whatever you do. Perseverance, right? We persevere, be cautious of an easy answer that avoids uncomfortable situations, right? Creativity. Then we have integrity. Recognize when your opinions conflict with those of your patients. Review your position and decide how best to proceed to reach outcomes that will satisfy everyone. Do not compromise nursing standards or honesty when you're delivering nursing care. Then humility. This is a very important one. Recognize when you need more information to make a decision. When you are new to a clinical division, an area, for example, ICU or emergency department or med-surg, ask for an orientation to the area. Ask the other nurses regularly assigned to the area for assistance with approaches to care. This is where most medical errors occur, is when people are not humble. They let their ego get in the way and causes medical errors and even injury and death. Standards of critical thinking. What are these standards? We have intellectual and we have professional. What intellectual standards include being clear, plain and understandable language, precise, exact and specific, accurate, true from error, make sure they're free from error, relevant, essential and crucial to a situation, plausible, that means they're reasonable, consistent, logical, deep, containing complexity in multiple relationships, broad, covering a multiple viewpoints, complete, significant, focusing on what is important and not what's trivial, adequate, satisfactory and quality amount. So these are all intellectual standards that are a component of critical thinking. What about professional standards? And we have ethical criteria. We talked about ethics earlier, about a week or two ago. And then, evidence-based criteria. You studied evidence-based practice and the criteria for professional responsibilities. All of these are part of critical thinking. Now, we know what critical thinking means. We know what the standard guiding standards are. Now we talked a little bit about the attitudes of critical thinking. Now let's talk about the skills. What are the skills you need to critically think? You need to interpret, be orderly and organized when you're collecting data. Analysis, to be open-minded when analyzing information. Avoid careless assumptions, right? Inference, look at the meaning and significance of your findings. Evaluation, look at the solutions objectively. Use objective criteria like standardized scales to determine the result of your actions. Don't assume. Explanation, support your findings and conclusion. Use your knowledge and experience to care for patients. Self-regulation, reflect on your experiences. Now let's talk a little bit about diagnostic reasoning. What is diagnostic reasoning? It's a form of decision-making that involves being able to understand and think about clinical problems, gather information about the problem, analyze cues, understand the meaning of the evidence, know when there is enough information to make an accurate diagnosis, or do we need more information? Then we have, once a diagnosis is made, consider different causes of the problem. Don't just feel, okay, this is it, I know now. It could be other things too. Just like in the case of Mr. Payne, he had abdominal pain. Anna gave him the medication, but now he has chest pain. Instead of Anna thinking, okay, well, that's related to his abdominal pain, his surgical wound, she would have missed something more important. Decide on the intervention that best meets the needs of the patient. This is the reasoning that you will use to come up with a diagnosis for your patient. And when we talk about nursing process, we'll talk in more detail about nursing diagnoses. So Anna enters Mr. Payne's room and finds him to be restless and short of breath, and he tells her, I have this terrible pain in my chest. What might such a change indicate? So this is when diagnostic reasoning begins, when you interact with your patient or make physical or behavioral observations. So let's see what Anna did. Anna observes patterns and themes. She observed that he has shortness of breath, sharp chest pain, a cough that produces pink mucus, and an irregular heart rate. She makes a clinical judgment quickly because now he has short of breath, and that's a priority. So she quickly makes a judgment that a clot may have dislodged and traveled to the lungs, requiring a quick medical response. Now her knowledge about what happens after surgical procedures and the high risks of developing blood clots is coming into play. She collects and analyzes the information. She leads to a diagnosis of a patient's condition. Example, nursing diagnosis of impaired gas exchange. She cannot diagnose a blood clot. That is a medical diagnosis which a doctor will do. But what she can diagnose is impaired gas exchange, where the air is not circulating and he's not, exchanging oxygen, carbon dioxide, and oxygen in his body. She forms a nursing diagnosis, assess and monitor each patient closely, and compare the patient's signs and symptoms with those that are common to a medical diagnosis. Example, in the case of Mr. Payne, it's a pulmonary embolism. Now using diagnostic reasoning, understanding the nature of the problem and the patient's response through data, assessment, and analysis to enable a selection of proper therapies. So this is how Anna used critical thinking, clinical judgment, and diagnostic reasoning to come up with a diagnosis of impaired gas exchange. So now she has to make a decision. When faced with the clinical problem involving a patient and need to choose a course of action from several options, this separates professional nurses from technicians or other assistive personnel, because it requires the use of judgment in investigating and analyzing all aspects of the clinical problem, applying scientific and nursing knowledge to choose the best course of action. For example, in this case, Anna could not have asked her CNA, what do you think is happening with Mr. Payne, right? So she's the nurse and she has to come up with that clinical decision. So skilled decision making occurs through knowing the patient, taking time with the assessments, positive emotional connections, knowing trends. Okay, is it getting worse? Is it getting better? What's normal and what's abnormal? Know typical behaviors, schedules, preferences of the patient. Get to know your patient. Active listening, listen to the patient. The patient is the best historian of their health issue. So listen to them actively. Frequently monitoring the patient. And then you would reflect, purposefully visualizing a situation and taking the time to honestly review everything you remember about it. So this is a acronym you can use: reflect, recall the events, examine your responses, think about or discuss your thoughts and actions at the time of the situation, right? And like apply this to the whole situation with Mr. Payne and Anna, right? F is for acknowledge feelings. Identify any feelings you had during the situation. Learn from the experiences. Review and highlight what you learned from the situation. Explore the options. Think about or discuss your options for similar situations in the future. So when you're faced with this again, being able to know what's going on, what could be happening. Then we have create a plan of action. Create a plan for how to act in a future similar situation. Then time, setting a time. Set a time by which your plan of action will be completed. So this is the nursing process and clinical judgment. The nursing process is a framework that we use to apply critical thinking in nursing practice for making clinical decisions. It has 6 steps: assessment, diagnosis, planning, implementation, and evaluation. We call it ADPIE, ADPIE. Then we have the clinical judgment model, which is 6 cognitive skills used to guide nursing practice: recognizing cues and analyzing cues. So these are similar to the assessment part of the nursing process. Then we have prioritize problems and diagnosis. And this is similar to the diagnosis stage of the nursing process. Then we have generate solutions. Generate solutions is planning in the nursing process. Take action is implementation, and then evaluate outcomes is equivalent to the evaluation stage of the nursing process. This is a diagram that shows the relationship between the nursing process and the clinical judgment model and how nurses come up with clinical decisions. So this, just putting it all together, this is everything that is involved in critical thinking and clinical judgment and clinical decision making. Please look over this diagram. It's the knowledge base, the knowledge that you gain as a nurse in nursing school through courses, the critical thinking attitudes, the environment that you work in, your experience, and then the standards that you as a nurse are obligated to follow. All done. I will see you in class.